70% of adults are going to experience low libido at some point in their life. But we make it seem like not only is it a taboo subject to even talk about, we make it seem like it's so uncommon, especially if you watch the movies, that people are shocked when they go through an experience of low libido. Well, not today, right? Here in the Lunch and Learn community, we're going to talk about low libido. What are some typical causes of low libido? Like what would typically bring someone to, when I was doing outpatient, my office, with that complaint or concern. I don't want to call it complaint, concern. And more importantly, what can you do about it? Because it's one thing to say a whole bunch of people will experience low libido. It's another thing to try to figure out, like, hey, when a lot of people experience low libido at some point in their lifetime, like, what can they actually do about it? And of course, that's why here, Medicine Mondays, Dr. Barry Pierre. Let's talk about it. So, as the introduction kind of points out, a lot of people are suffering and dealing from low libido. And it does not have to be a lifetime event or something that just kind of carries them on for years and years, but it is something that it isn't out of the ordinary if that occurs. And what happens is that when it does occur, especially because typically, you experience it in a relationship, there's always, consternation, there's always concern, there's always stress that gets added to a relationship because a lot of times the partner, right, is trying to figure out like, hey, how come, you were good a week ago and now like you don't want to do anything, so they automatically start blaming themselves. So I think for first and foremost, as a provider, when we're talking to our patients, a lot of times we don't do a good enough job setting up the expectation. So a person comes into our office, they're dealing with low libido related issues, and we make it seem like, all right, yep, I hear your problem, let me solve it. But we never help talk our patient off the ledge. We never help educate our patient and say, hey, you know what? You are not alone. You are not the only one experiencing it. It may not have to be something directly by you. It could be some outside force that's causing you to have low libido. But that's why you come to me, because I am going to hear and I'm going to find that answer for you and hopefully get you to the quote unquote promised land. So I think first and foremost, as providers, we have to do a much better job educating our patients to say, hey, low libido is normal. It could be normal and temporary, and it has nothing to do with the other partner, right? Like, I think if we just really hark on those three things there, you'll go a long way in your partner's relationship, right? Like, they'll love you because it will help alleviate a lot of stress that, having low libido or dealing with it, whether you're the partner or not, is something that I think really needs to be talked about. So I remember I had a patient when I was doing outpatient medicine and she was probably in her 40s. Yeah, she was like in mid 40s, and, her and her husband, been together for about a decade or so, but she started experiencing this episode of low libido, right? Where it just wasn't in her. Right? The energy wasn't there. The want wasn't there. The need wasn't there. Because a lot of times people would be like, oh, you need to have sex. How can you not have sex for 50 million years? Right? And a lot of times when you are having to counsel the patient, a lot of times you have to counsel the partner as well. Right? So experiencing these issues has been going on for some time. And now it's gotten to the point where they're coming to see me because who do I need to see, doc? Like, is this a medical problem? Because typically, right, you go to a doctor to say, hey, you know what? This has to be some medical reason why my lack of sexual desire is kicking in, right? Like out of nowhere, it almost seems like. Usually it's not. Usually it's something that kind of bubbles under the surface until it blows up. But come to see you to kind of rule out all the medical related things that could be added to it, right? So my education at that point, especially with my patient, is one, right? And we kind of talked about it, talking them off the ledge, like, hey, come over here. Like, come off the ledge. It's okay. Educating them on what could be happening, right? And more importantly, letting them know that it's not your fault. It's not your partner's fault, right? It just kind of happens. And I could tell she was so relieved from it. Right? Because she came in solo. She was so relieved from it, right? Because she was sure it was something that she was doing purposely and she couldn't explain it. And she understood that, like, hey, you know what? This is causing stress in my life right now, in my marriage right now. So she understood kind of those ramifications of what could occur if it doesn't change. So she was delighted to hear that, you know what? There's other reasons that this thing could be happening, right? Because people always think about like menopause, and especially for the women, right? Menopause and things like that, but which there are hormonal reasons, right? We're not going to skip over that, right? But she wanted to know that, hey, you know what? There is possibly a medical reason why I'm just not feeling like having this, right? For her, that was important to note. When I think about the doctor-patient relationship, having that level of comfort with your doctor, that you can go to your doctor and say, hey, you know what? Me and my partner, we're having problems. I'm just not feeling it anymore. I don't want to have sex anymore. What is it? Is so important, right? Which is again why I always stress having a great not even a good one, a great doctor-patient relationship. Because if you never get to that point, guess what happens, right? You never make the appointment. You never show up for the appointment. You deal with all of the stress and angst in your relationship by yourself because you're like, you know what? I don't have anyone I can talk to who I think would understand what I'm going through, right? So it's so important to have that good doctor relationship. And that was just a very good example of it, right? Because once we were able to kind of go through the steps, right, where, obviously we're doing all of the blood tests, we're checking all of the markers, we're trying to rule in and rule out things that we know can attribute to the lack of sexual desire. You could tell that, she was just so elated to know that, you know what, there is a light at the end of the tunnel. And even though I may be experiencing it right now, it doesn't mean that I'm going to experience it for the rest of my life, right? So that was definitely something very great for her to hear. And it was great, especially as a physician, it's great to know that you can have such a significant, because again, a lot of times, especially as a doctor, right? Especially most doctors who don't, let's say I'll think about my surgeons, for example. My surgeons come in, broken bone, right? Gallbladder inflamed, appendix inflamed. They come to fix the thing. There's a bit of satisfaction knowing that, hey, you know what? I came in and I fixed the thing. I took it out or I mended the bone. Especially from a primary care perspective, a lot of our healing comes in the conversation, in the follow through, in the follow up. So a lot of times it's not an immediate, thing, right? Like unless I'm giving you some antibiotics and you feel great the next day, right? But a lot of times it's not an immediate fix. So being able to have that relationship with your patients to know that, hey, you know what? The problem you have with this low libido, not wanting to have sex with your husband, is not a you thing. It's not a him thing, right? It could just be a thing. Let's find out what the thing is. Very, very, important for your patients to know, and very, very important for your providers, right, to be a part in that process. So let's talk about some of the things that are related to the causes of low libido. And I do have a blog post discussion on this that I'll put in the show notes because I think it's important, right? But more importantly, I think sometimes you can hear, especially if you're my podcast listener, you can hear my words. If you're my video watcher, you can watch the words, but a lot of times just reading it on your own and kind of, being able to kind of do your own detective work is extremely important, right? So let's talk about some of the causes associated with low libido. If you think you're experiencing it, and then maybe one of these causes may hit a light bulb and say, you know what, that could be me, right? And then that should push you to go, reach out to your doc and find out what's going on. All right, so let's talk about some of the causes of it. This is a great list. Stress, that should be number one, right? A lot of us are dealing with stressors outside of the relationship that are causing issues inside a relationship. How many of y'all are yeah, that makes sense, right? And I'm talking about job stressors, friend stressors, family stressors, financial stressors. A lot of you guys are dealing with stressors outside of the relationship that is directly causing issues inside the relationship. Now, I say stressors. You can have stressors inside the relationship, right, with your partner, right, that could also be causing, right, your low libido. But I want to make sure to understand that, yep, you can have some outside stressors, inside stressors, but stressors nonetheless can have significant effects on your state of libido. Being overweight, right, this is one where I shouldn't get in trouble for saying this, right, but I think it's sometimes surprising when you think about it, right, because again, obviously I'm speaking from a physician who is overweight, right, so a lot of times what I see online now is this almost movement to not blame weight on things, right? I was watching this one TikTok video. If I can find it, I'll put it in the show notes. I was watching this one TikTok video where the patient went up to the doctor and said, hey, you know what? I'm about to have this doctor's appointment. I'm not going to get weighed in, right? I'm not going to do my vitals, which again, weird to me. And the conversation we're going to have, you can't mention my weight. So she wanted to have a conversation about just some different medical issues, right? And she did not want the doctor bringing up her weight. And I couldn't understand it. I thought it was very confusing, right? And I think sometimes, yes, there is this pendulum that tried to blame every single thing on the weight, right? Oh, you're overweight, so this is the problem, right? Fix the weight, fix the problem, right? And no, that's not 100% true, but it can't be swung to the side where we have to act like being overweight may not be an issue, right? So, and I wanted to stress that because and it was on my mind because I saw that TikTok video like kind of recently, and I just like, oh, I gotta talk about that. Like, I thought that was kind of wild. Yeah. So yes, weight issues can be an issue as far as low libido, especially because it typically follows along the lines of poor dietary habits and poor activity related levels, right? So very sedentary lifestyle, right? So like that combination, right? Poor dietary habits, extremely sedentary lifestyle can lead to being overweight, which can lead to having low libido related issues, which is why a lot of times for who work out a lot or people who have lost a lot of weight, they will tell you one of the things that has improved is their sex life, right? Now, is it improved because they're losing weight and they're finding more? I don't know why it's improving, but they'll tell you that it's improved as I work out. And I think a lot of it has to do more with the working out and everything, but like, you know, if they look better because they lost weight, you know, maybe they're having, you know, the ability to have more sex. I don't know, you know, put in the comments if you have correlation. I got some, but like put in the comments if you have correlation. There's certain medications that can definitely affect it, right? A lot of the cardiac related medications can definitely play a factor in low libido, right? And just a poor sex life. A lot of our SSRIs, you know, our depression, anxiety type related medications can definitely add to this instance of low libido, right? So definitely something to kind of think about, right? When we're thinking about, you know, is it my medications, right? Because again, you come to the doctor, right? We're going to go through, it's almost like a hamster wheel of things that we got to go through, right? Like, all right, is it the stress? All right. Overweight, poor dietary habits. Is it your medications? And obviously I talked about the relationship issues because if you have relationship issues, that should come as a common, like, no duh. That, yeah, if I have relationship issues, I'm going to have low libido. And then there's just chronic health related issues when I think about hypertension, when I think about diabetes, right? Like coronary artery disease, right? Those are the two biggest ones. Lupus, autoimmune related issues, right? Hypothyroidism, hyperthyroidism. These are issues that can affect your libido, right? So it is not they just don't like me anymore, right? And when you talk to the partners, they tend to have this, and I'm not sure why, right? But they tend to have this concern that it's like, oh, they don't like me anymore. That's why they don't want to have sex with me no more. And they totally ignore all of the other, you know, spokes in a wheel that could be adding to this low libido, right? So I want us to kind of think about those reasons. Think about, hey, where could I possibly fall in line with, especially if you or your partner is experiencing low libido, right? Like think about like, all right, what can my partner or myself be affected by that's adding to this aspect of, you know, just not having just a low bit of sexual desire. And I think next I want to just talk about some ways to either treat it, right? I don't want to say treat it. I would say treat it or just help it improve to try to get you back to your baseline sex life, whatever that baseline sex life is. So when we think about the solutions for the boosting of our libido, of course, right, you know, refer to the last section as far as our hamster wheel, right? We have to try to solve the underlying problem, right? So it takes going to see a healthcare professional, right? Whether it be a physician, whether it be a therapist, going to see some professional to try to help you align your tire to figure out what is causing the issue. So if it's a medication problem, right, you need your doctors to be able to identify the medication problem, right? If it's an issue with your chronic disease, whether it be your diabetes not being controlled, your hypertension, your coronary artery disease, your lupus, one of these things, your depression, right? One of these things that are just not in homeostasis, right? You need a professional help get that back in line because there is no solution to your low libido if we don't treat the problem. We don't want to add, because I don't want to tell you that there's a magical pill that you can take and then your libido is great, right? And especially when I think about my men who will come to you with, you know, impotence related issues and they just want the pill. Give me that pill. And you have to educate them, right? We got some blog posts on that. You have to educate them and say, hey, you know, it may not just be like, you know, the fact that you need this pill, right? We got to make sure, like, There's not no other medical issues and problems, because I say all this time, when it comes to erectile dysfunction, there's a lot of outside issues, or more important, internal issues that you got to make sure it gets addressed first before you're giving these people Cialis or Viagra, right? Like there's some medication you got to think, there's some problems you got to worry about first. The same thing with low libido, right? There isn't a magical pill that I can give you and boop, your low libido is up. But I do have to treat like your depression, right? I do have to treat your diabetes, right? I do have to make sure I'm not giving you the wrong medication, or the medication you're having is doing great on one area of your body, but causing problems in the other, right? Like I have to make sure I identify that. So it's a matter of identifying, hey, what is our problem when dealing with this low libido? Like, what is the real issue that I gotta face? And then hitting it on head first, right? So understand that, yes, you know what? I may have to exercise more. I understand that, you know what? I may have to go away from those certain foods, right? I may have to change my medications, right? I may have to talk to someone, right? Because a lot of times we can rule out the medical. Ruling out the medical stuff is kind of easy for me. Some blood tests. I'm doing some blood tests. Boom, 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 boom. But a lot of times, once you rule out the medical, if the issue is still there, right? There's the mental cognitive opponent associated low libido that's got to be addressed. Hey, what happened? Why do you have this low libido, right? Why did it suddenly come on, right? Or why has it been with you for the past 5 years and doesn't seem to go away or improve regardless of who your partner is? Like, why is that? And having these deep conversations to make sure, again, this is where the provider and the patient relationship is so key, because if you have these deep conversations and you clear out all of the medical related issues, it's not a big leap for them to want to say, you know what, maybe I need some extra help, right? So understand that there is no silver bullet to the treatment of your low libido, right? There are factors that you can help improve. Yes, there's some vitamins, there's some nutrients, there's some minerals that you're probably low in. That kind of speaks to like the dietary component associated with it, but there's never going to be a one size fits all approach to this low libido, right? The only thing that as a provider you need to get a handle of is, one, talking your patients off the ledge, and sometimes having to help talk their partners off the ledge, and helping your patient find the appropriate solution. Because if you help your patient find the appropriate solution, regardless of how many, things they have to rule out, their relationship is going to love you. You are going to be like their imaginary wall of Hall of Fame people who help move this relationship along. So you got to do that, right? And I'm very interested to see, what's going to happen in the future, right? And the reason why I asked this, right, is this used to be an old person thing, right? This used to be a thing that we would expect 40, 50, we would expect some years to go by before you start experiencing it. But that's no longer the case. A lot of young people, right, my 20s and my 30s, are experiencing these same issues, these same effects, right? Is there substance related issues? This is mental health related issues. It's probably a combination. But again, this is not just an old person issue, right? And a lot of times, especially here in the Lunch Learn community, I'll see comments that say like, I'm too young for that, right? Like, nah, that don't got nothing to do with me, right? And you'd be surprised what like has to do with you these days, right? Especially as we live longer, right? But, a lot of us are experiencing life and the stressors of life a lot earlier. Shout out to social media. So it just comes into play when you are trying to counsel your patients. Understand that, yes, low libido is real. No, it doesn't have to only be due to, their partner. No, it's not the person's fault. And yes, there are things that we can do to try to help get you on that journey of improving your status, right? So, I'm yours truly, Dr. Barry, right? Thank you for checking in on another amazing episode of Medicine Mondays, and I'm gonna see you guys next week.